Hello friends, welcome to our new video. We pharmacists say that while giving medicines from the pharmacy, it should be taken on an empty stomach. Why and how? If there is a question from the side of patient, we are obliged to answer it. In today's video, I am sharing some things I know about it. Taking medicine on an empty stomach typically means it should take 1 hour before or 2 hours after meals. Not to mix any food, drinks, or other medications without speaking our healthcare professionals. This is because even our morning coffee could affect the way some medications get absorbed into body. Why some medications need to be taken on an empty stomach? The reasons include presence of food may affect breakdown and absorption of drug. Food can delay the time it takes for certain medications to be absorbed by our body. This can cause the medications to take longer to work. Some foods, drinks, and supplements can lower the amount of medications that get into our body. This usually happens when these foods or drinks attach to the medications in our stomach. Some juices like grapefruit juice can cause certain medications to get broken down faster in our body. If this happens, our medications might not work as well. Juices can also sometimes cause medications to get broken down more slowly. This can lead to build-up in our body and cause more side effects. Here are a few things we pharmacists should know about grape juice and medications. Grapefruit juice containing compounds furanocaumari that inhibit an enzyme called CYP3A4 or cytochrome P453A4. It is the most abundant drug metabolizing enzyme in human liver and small intestine, responsible for breaking down over half of all prescription medications, toxins and natural compounds. If patients have hypothyroidism, they may be taking a thyroid medication like levothyroxine. At the time of dispensing, instructed the patient to take it in the morning on an empty stomach. Levothyroxine should be taken 30 to 60 minutes before breakfast. Take it at least 4 hours before or after other medications. Alendronate, ibandronate, and risodronate. These are a few examples of bisophosphonates. They are a group of medications that help to prevent bone breakdown and are used to treat osteoporosis. Some foods, antacids, and supplements can attach to bisophosphonates in our stomach. This interferes with absorption, which is why an empty stomach is best when taking them. To avoid taking these medications with juice too. The study showed orange juice lowered alendronate absorption by about 60% compared to water. For alendronate and risodronate, it is recommended to take our dose at least 30 minutes before our first food, drink or medications of the day. It is recommended to wait at least an hour with ibandronate. Drink a full glass of plain water with pill. This helps the tablet move down to our stomach faster and thus to prevent damage to esophagus. Next drug is captopril. It is angiotensin converting enzyme inhibitors. It is used to treat high blood pressure and heart failure. It also used to treat kidney problems in people with type 1 diabetes. Taking captopril with food can lower its absorption and cause it to be less effective than taking it on an empty stomach. Ideally, this medicine should take 2 hours after meals. Next drug is isoniazid. Isoniazid is an antibiotic that is used for preventing and treating tuberculosis. It should be taken on an empty stomach because it is not absorbed as well when it is taken with food. Next category of drugs are proton pump inhibitors. It works by blocking final step of acid secretion in stomach. Food triggers stomach to produce acid. These drugs block acid secretion before acid gets triggered. That is why it is typically recommended to take before meals. Generally, these drugs take 30 to 60 minutes before meals. However, esomeprazole should be taken at least 1 hour before meals. The one exception is pantoprazole tablet. which work normally whether we take the medication with food or on an empty stomach. Next drug is ampicillin. Some antibiotic can take with or without food, but ampicillin is one that must be taken on an empty stomach. Because it is taken with food, the absorption of ampicillin is delayed and the medicine becomes less effective. It is recommended to take ampicillin 30 minutes before or 2 hours after meals. Thank you friends. Thank you very much. See you again next video.